So a few minutes before I got up to start this session, I got a call from a close friend who wanted to talk to me about another friend who has a chronic condition and also has bipolar disorder, and is currently having a manic episode and has gone off for meds for her other chronic condition. And I think this really calls into focus the issue of mental health with regard to management of HIV, management of other chronic diseases, and the barriers that mental health issues can present to health and wellness overall. Certainly, the National HIV/AIDS Strategy calls for a focus not only on mental health, but also on substance abuse issues, which we know are so consistently intertwined in many of our lives. So it's my pleasure to bring to the stage Mr. Michael Duffy from SAMHSA to talk about how SAMHSA is addressing the intersection of substance use and mental health with regard to HIV/AIDS and implementation of the Affordable Care Act. So Mr. Duffy, please. Thank you.
I do, first of all, want to acknowledge that our medical director, Dr. Ellie McCants-Katz, could not be here, and so I'm here on her behalf, and I will leave it to you to determine who's the better looking. I was asked to share on a personal note some of my experiences here in the state of Louisiana prior to working with SAMHSA as their SAMHSA regional administrator. I had the opportunity and privilege of facilitating one of the first HIV/AIDS support groups in the mid-'80s here in the northern part of the state. It was that experience that has embedded in my heart a desire to make sure that we do all that we can in working with HIV-infected folks who have accompanying behavioral health conditions. I then had an opportunity to serve under the last 3 governors in this state as the state director for the Office for Addictive Disorders. And now as the SAMHSA regional administrator working with 5 states, recognize and realize all too well the challenges that comorbid behavioral health conditions and HIV present to our healthcare system in general. You know, it's SAMHSA's belief and understanding that behavioral health is essential to all health, and most especially for the health of those with HIV, that we now have, for the first time in the history of SAMHSA, a regional presence throughout this country within Health and Human Services. And you'll see the slide of the mugshots of the 10 of us who represent SAMHSA within HHS. And I want to encourage you to make those connections and let us know if there are ways that we can in turn support you in the work that you're doing. I'd also like to bring to your attention one of the, I believe, most important pieces that SAMHSA has to contribute to our work in moving forward with the Affordable Care Act. We just recently released, as a result of some work that we've been doing with 5 national coalitions, and if you think about the coalitions that I'm going to mention, they're all coalitions that I think you'll find that we have common partnerships around. One has to do with mental health and substance abuse providers across the country, prevention coalitions. We also work very closely with the homeless coalitions, as well as the criminal justice population and those individuals in recovery from mental health and substance abuse. And as a result of this work, we've touched over 40 national coalitions, but recognize very clearly that a lot of folks don't have at their fingertips the resources necessary to understand all the ramifications of the Affordable Care Act. So we've partnered with our colleagues at CMS and put together a toolkit which offers the opportunity for local coalitions and stakeholders to view a 30-minute video, which then has tied to it, and it walks you through the 119 different resources, everything from PowerPoints to widgets, to help make certain that at the local community and stakeholder level, folks have those resources available to them. You know, we started this session today with a reminder that we have this historical moment in time to change the lives of millions of people in our country. But I would suggest to you that all of our federal partnerships and all of the work that we're doing, the work that's being done at the state level, absent individuals and communities and stakeholders across this country, and each of you in this room will never accomplish the goal. So I'm asking you to give consideration to what one of us alone might not be able to do, all of us together can. Thank you.